Hello and welcome to your monthly update from the COVIDENCE UK study. My name's Adrian Martineau. I'm the Chief Investigator based at Queen Mary, University of London. And with us today, I'm delighted to be able to welcome Dr. Callum Jackson and Dr. John Blaikley from University of Manchester, who are going to tell us about their recent findings relating to sleep and long COVID. Callum.
Thank you very much, Adrian, and hello everyone. It's an absolute pleasure to be invited here to talk to you about the research we've been working on for the past few months. So, as Adrian alluded to, we have been looking at sleep and actually how this may relate to breathlessness in long COVID. In order to do this, we looked in a large UK cohort of patients who had been hospitalised with COVID all across the United Kingdom. And the first question we really wanted to know is sleep disturbance common after hospitalization for COVID-19? And what we found is actually that on average, 6 out of 10 people meet the clinical definition of having poor sleep quality. And in fact, further to that, these patients were sleeping 1 hour longer and exhibiting more irregular sleep patterns than healthy controls. So we saw that sleep disturbances are common, but we also wanted to find out, well, what could some potential consequences of these sleep disturbances be? When we looked into this, we found that those who reported sleep disturbances actually scored worse on breathlessness questionnaires. So those who were more likely to report sleep disturbances were also more likely to report more severe breathlessness. However, this isn't just a simple association where we can say there's a link between sleep disturbance and breathlessness. In fact, as I'm sure you know, long COVID is a massive net full of different symptoms. And here are an example of 2 extra symptoms that can all feed into breathlessness. So it's really important for us to actually try and understand what is the interrelationship between all these factors. And that leads into some of the future questions we want to ask based on this work. So the first one is what is the cause of the sleep disturbance? And secondly, actually, is one factor causing the other? Can we understand if sleep disturbance is causing breathlessness, or are they just associated in the net and web that is long COVID? An important caveat to what we found is that currently we do not have any evidence to say that treating sleep disturbances will improve long COVID. But saying all this, I would like to say thank you for the invitation to talk here. Here's some extra information if you wanted to read up more. I've given links to the paper that was published in a leading respiratory journal, as well as a link to cover the press coverage of this paper. Thank you very much.
Thanks very much, Callum. That was really interesting, and we'll be sure to include the link to the Lancet Respiratory Medicine paper in the text underneath the YouTube webinar. Now, I guess this raises some pretty interesting questions, and I wondered if either you or John had any thoughts about or any information about whether people were breathless before they had COVID-19.
So I think, Adrian, that's a really great point. So we don't really have much pre-morbid data. So what we do have is evidence of what medical conditions the people actually had before they contracted COVID-19. So we incorporated that into our statistical modelling that Callum did, but we haven't got great pre-morbid data, and this was because of how the cohort was designed. We only recruited participants when they got COVID rather than before they got COVID.
All clear. And now it's obviously no coincidence that the three of us are talking on this call, because we've got some research hatching using some of the data from the COVIDENCE study to take some of these interesting findings forward. Do you want to talk a little bit more about how we might be able to, or how you guys might be able to make use of the COVIDENCE data to gain extra insights?
Yes, that would be great. So I think the really nice thing about the COVIDENCE data is that, of course, you recruited participants before they got COVID. So we can understand some of that pre-morbid sleep patterns and other things that could be actually affecting the sleep. In addition, we only looked in our story about 8 to 12 months after COVID, and then in COVIDENCE, you've obviously got a much longer follow-up. We also don't know what happens to individuals if they get COVID again, but of course in COVIDENCE, you've got that longer term follow-up. So what we're hoping to do is fuse the data that we've already got in FOSP, and we're working closely with the FOSP investigators, also with the COVIDENCE investigators, to really try and understand this a bit more. The other thing that we're really excited about is perhaps what Callum alluded to, that although we haven't got data suggesting that looking at sleep or perhaps trying to help people optimize their sleep patterns is helpful, then we can also try and see whether that would be possible, because we know that sometimes intervening with sleep can be beneficial, but also in lots of trials intervening with sleep hasn't been beneficial. So we obviously don't know what the outcome is in this situation.
All clear. I mean, I think what's exciting is that not only does your research highlight a potential mechanism of what's going on, but it opens up an avenue for developing potential therapies to make people recover more quickly, which is ultimately what we're here for.
Absolutely. Although, you know, trying to have a good night's sleep is something a lot of us struggle with, and it's very hard to achieve. So I think it's really important to stress that we are working closely with wonderful researchers at different universities to try and find out the optimal way in which we can help people with COVID. But I don't think we've quite got that yet. And equally, I wouldn't want people going to their healthcare provider saying, look, please just optimize my sleep and everything will be better. We don't think that's the case at all.
No, I hear you, and they're important caveats. But I think another thing to emphasize is the value of the ongoing contribution from COVIDENCE participants. You'll know that in the monthly questionnaire, every month we ask you about your sleep, how long you slept, and at baseline we asked what time you went to bed, when you woke up. All of these things can provide us with a lot of information about sleep patterns, both as risk factors for and consequences of COVID-19 and other respiratory infections. So to close, really, just to emphasize the value of your ongoing contribution to COVIDENCE, and also to thank Callum and John for joining us today. And I hope that in the months ahead, we'll be able to do another webinar together, presenting some of the findings of analyses from COVIDENCE data on this fascinating subject. So from me and from all on the call, goodbye.
Thanks, everyone.